Hi everyone, this is the series Straight Talk About Old Age, and this is chat number 4. The topic is safety. Older people have specific vulnerabilities related to this topic. Number 1 is falling. The odds every year of an older person falling are 1 in 3, and a third of those who fall have moderate to severe injuries. This is often the start of a downward spiral and usually takes the person away from their independent living for temporarily at least a year. I've often thought that older people could use some sort of circus training to learn how to balance better and how to fall gracefully. Some people fall because of osteoporosis. Spontaneous fractures occur and the person falls down. Other times it's due to balance problems, an awkward gait, dizziness, which is a big topic, and just general loss of strength. Another vulnerability older people have is to financial exploitation. Because mental processing is slower as we age, older people are often targeted because they're so easily rattled. Often there are self-esteem issues over inability to think on one's feet, and this is exploited by fast-talking, high-pressured salespeople. I think there should be practice of 24-hour waits on any financial decisions made by an older person. Another vulnerability is to abuse, elder abuse. Oftentimes loved ones feel dutiful in caring for an older person, but they're clueless about that person's real needs. Most parents do not share their problems and their challenges with their children as they are raising them, and so the children have an unrealistic idea about their parents' needs in older age. Another vulnerability is to dehydration, because the kidneys and the heart no longer function the way they did in younger years. Older people are particularly at risk for dehydration and overhydration, and of course its associated electrolyte imbalances. Thirst is no longer a reliable urge in older people, and often they purposely drink less to cut down on bathroom trips or to manage incontinence. Problems come up when the person has a flu or trauma, surgery, anything unusual, and the downward spiral occurs so fast that usually this is what lands an older person in the hospital, the need to be monitored. Taking lab tests on fluids and electrolytes has to be balanced with clinical observation. Another safety factor has to do with cognitive impairment. I often think this deserves something on a billboard which says, "Trouble thinking does not indicate stupidity." If you have ever been humiliated, patronized, or treated as an idiot, you can go along with this strong feeling of mine. There are 3 Ds to consider here: delirium, dementia, and depression, and all 3 produce cognitive impairment, trouble thinking. This disallows people to use their intelligence and makes them vulnerable because they cannot smoothly assert their own needs and act in their best interest. Often emotional states occur as a result of this situation. People become panic-stricken, angry, irritable. It's very, very difficult to cope with cognitive impairment. There are many aspects to cognitive impairment, such as memory problems, concentration problems, inability to express oneself, to make decisions, and then disorientation and outright confusion. Now, delirium is something that is very common in older people in the hospital. Surgery and acute illness will bring this on. It's a temporary condition which also has physiological counterparts, such as an elevated blood pressure. Dementia is something that creeps up slowly, and 1/3 to 1/2 of people over 85 have dementia. It is often something unsuspected because the person can be very alert and very smooth, gracefully social. They compensate for their losses over time. The causes of dementia are many. There are more causes than Alzheimer's disease. There could be multiple infarct dementia from the accumulation of tiny strokes. It could be a major stroke. It could be due to toxicity from the side effects of medication, or concussion from falling down. Some of these causes are reversible and some of them are not. One thing is that dementia inevitably causes depression because it is a loss. And most doctors will initially test for the causes of depression, and 40% of the time some hidden medical reason is found. Another aspect of safety is being prepared. And I'm sure that most of you have many pharmacies, many drugstores hidden away in your pantries and closets. I will not belabor you with my inventory list, which is quite long to handle all of these problems and vulnerabilities. There are a few things that you may not have on your list. Since we just had a power outage, I thought about this. What if you can't get your hot coffee? You'd better have some backup caffeine plan, like iced tea or Coca-Cola available. Always have a lantern available so you can make it to the bathroom safely. And a battery-powered radio is not a bad idea. Another thought I had was about liquid bandages. If you are falling down or get scraped up by some accident, you don't want to have 50 band-aids that you're going to have to rip off later and possibly tear your skin. So a bottle of liquid bandage is very helpful. And lastly, a mucous membrane moisturizer. Since dehydration and dry mucous membranes are so common in older people, some membrane moisturizer can go a long way for your comfort.